Something not a lot of people are talking about is this healthcare portion of the American Rescue Plan, that they put in there. And here's Chris Murphy's tweet. I showed it on the show before, but this is what he said. Little notice but super important provision of the American Rescue Plan. It dramatically lowers premiums for ACA health plans, caps premiums at 8%, it's 8.5 of income, no premiums for anyone 150% of poverty or below. That's huge and so important in the middle of the pandemic. So, the Democrats have been putting out all these, stats. Like one of these, sounds really good, and it is good for those. I mean, we'll discuss and explore a little bit what this is going to mean for people in that bracket. 150% of the poverty line, which is only $12,000. So that's it's $18,000. Like it's not a lot of money. There's a lot of people that struggle with healthcare expenses that make more than that. But we're going to explore exactly what's in this bill and what it's going to change as far as healthcare. It seems like it's being pushed as kind of some type of fix or big fix, to the healthcare issue that we have in this country. And we know the healthcare is a really big issue in this country. People can't afford their premiums. People can't afford their deductibles. 500,000 people file for medical bankruptcy every single year. 500,000 people. Unbelievable. So that's such a huge number of people. And that's year after year after year after year. And anywhere between 40 and 65,000 people die every single year because they don't have access to healthcare. They can't afford it, so they end up not going. And they die preventable deaths. So I remember when I saw this. This was back in January, I believe. This is from Gideon Resnick says, per this story, Bernie Sanders has been talking to Biden about the next stimulus package, including an emergency universal health care program so that anyone can get medical treatment during the pandemic, whether they currently have insurance or not. Now, of course, that would be a great idea. Expand Medicare. And we'll discuss exactly why you would rather expand Medicare as opposed to subsidize COBRA, which is what this the American Rescue Plan does. It subsidizes COBRA up to 100%. So we'll subsidize all those the premiums that are way higher on COBRA than regular premiums. And by the way, COBRA is basically if you lose your job and you had healthcare through your employer, you can keep the same plan that you had with your employer, even though you're not currently with that employer anymore. And it's called a COBRA plan. But they're unbelievably expensive. And very hard to, pay for people, especially if they just lost their job. So that's what, Biden's plan does is it subsidizes COBRA. And we're gonna discuss why it's better to expand Medicare as opposed to subsidizing COBRA, which is basically a huge giveaway, to the healthcare insurance industry that are, providing those COBRA plans. So this is from the Daily Poster. This article came out, I think it might have been January or maybe December, but this is what they said in the article. It said nightmare deductibles and widespread claim denials. Oh, first off, let's actually look at this one first. President-elect Joe Biden's new COVID relief plan does not adopt the existing Democratic legislation, Bernie's legislation, to expand government-sponsored medical coverage, nor does it propose a promised public health insurance option. Instead, it adopts proposals from health insurance lobbying groups' recent letter to lawmakers demanding lucrative new subsidies for insurance companies at a moment when those corporations have recorded record profits as millions lose coverage and many face claim denials. So they sent a letter to Congress. Like, this is how much Congress is bought and paid for, especially the Democratic Party, by the health insurance industry and Big Pharma. They sent a letter. These lobbyists for the insurance companies sent a letter demanding subsidies, basically meaning the government is going to pay, use your taxpayer dollars to pay off, your own healthcare premiums to these health insurance companies. Doesn't that sound wasteful? Doesn't that sound like using your own money to help you pay for your health care coverage? Does that make any sense? Of course it doesn't make sense, because we're the only developed country that does it like this. it's it's crazy. It's just giveaways and giveaways to these corporations using your tax dollars. That's what these government subsidies are. They're your tax dollars. Biden's plan would shovel billions of dollars to private health insurers by providing subsidies for Americans to buy coverage through the ACA marketplaces, which are far more expensive than government healthcare programs and have at times been plagued by high rates of claim denials. So you could have been paying into this, your premiums for months, years, even decades. And all of a sudden, when you actually need the help, when you actually need that insurance company to cover something, which is why you paid that monthly premium rate in the first place, they can just be like, nah, we're just not going to cover you. We're just not going to accept this claim. So you've been wasting money giving them money. And then when you actually need help, they deny your claim and say, no, we're not going to help you in your time of need. Pay for, these, sometimes tens of thousands of dollars of, sometimes hundreds of thousands of dollars of healthcare costs. They just won't help you pay for it, even though you've been paying them for months. Those initiatives could further boost insurers' skyrocketing profits. That's what we already talked about. And the letter to lawmakers was from the AHIP and the Blue Cross Blue Shield Association, which are two lobbying groups in Washington. And so this is the difference between these COBRA plans that Biden's planning on subsidizing in the American Rescue Plan, and actually expanding Medicare, which was the legislation that Bernie was pushing for, and would be much better, something that progressives would support as a temporary, betterment of our healthcare issue and the place we are with healthcare right now. It says nightmare deductibles and widespread claim denials. Pushing people in the ACA plans and subsidizing COBRA coverage would be expensive, but not necessarily popular. Healthcare coverage purchased through the ACA marketplace costs 83% more than Medicaid coverage. And ACA plans leave patients with 10 times the amount of out-of-pocket costs, according to a recent study published in the Journal of the American Medical Association. That's because Medicare and Medicaid have the ability to actually negotiate prices with these insurance companies. So because they have to actually, honor these Medicare and Medicaid insurance plans that are provided through the government, they actually can negotiate the costs down. And so, of course, that's what you should do is expand that instead of expanding something that costs way more, because it just makes sense. It saves us, the taxpayer, money because the government is spending less in the subsidies, and it improves our access to that care. The researchers concluded that the marketplace plans cost so much more than Medicaid because private insurers pay higher prices for the same services, which is what I was just saying. Hospitals often bill people with employer health insurance plans, which are maintained under COBRA, which Biden is going to be subsidizing with this new bill, more than twice as much as those with Medicare or Medicaid. Let me read that again. Hospitals often bill people with employer health insurance plans, which are maintained under COBRA, more than twice as much as those with Medicare or Medicaid. So if you have Medicare, you will be paying half as much as someone who just has an employer health insurance plan. And so that, you're spending 2 times more. Now, if the government is going to subsidize that, they're subsidizing at that rate. Why would you not subsidize at the Medicare rate and just expand Medicare? Because they don't want to do that, because they want to just give money to the people that give them money to help them get elected. That's why. And so let's take a closer look at what's going to happen with this American Rescue Plan, because I've been searching up and down trying to figure out, okay, they cap premiums at 8.5%. First off, the previous law had it capped at 9.58% or 9.85, something like that. So it's really not that huge of a difference, right? They say they celebrate, we're capping it at 8.5%, but they don't tell you the difference, because it makes it sound better than it actually is for, the amount of people that it's going to affect. So let's look at this. This is from, I think, kff.org, and it's like if y'all want to go look at it, go look at it. It's like an interactive type thing where you can see, like, if you're making a certain amount of income in what state, what type of plan you could be eligible for with the American Rescue Plan subsidies in place. So Here you can see for someone with making $20,000 in income, age 30. The current law under a bronze plan, you'll be paying $3. Under the House bill, you're paying $0 on a premium because it's already heavily subsidized. Under the silver plan, it's 72, gold plan 98, and then respectively it's $4 and $36. But look at these deductibles. Look at these deductibles. The bronze deductible is still $7,000. So it's almost like you'd rather pay the monthly fee and get the gold plan, even with the subsidies, because the gold plan is $1,600. But if you have the bronze plan, you literally can't afford it. If you have a $7,000 deductible, guys, you basically don't have health care. Like, that's the issue with our healthcare system. If you have to pay $7,000 before the insurance company actually starts kicking in for those out-of-pocket costs, if you don't have $7,000, then you're screwed. You know, that's the whole idea behind why you actually need Medicare for all. You actually need, universal health care, so that things like, so you don't have deductibles, you don't have copays. It saves us a ton of money. This is why it costs half as much for twice the outcomes. You see around the world, people are paying half as much as they do per year in GDP on health insurance, on healthcare, and getting twice the outcomes. They have everyone covered. It just makes sense, and it's crazy that we do it like this, and it's so frustrating. So that you can see there, that's if you're making $20,000. If you're making $40,000 now, $40,000 is not a lot of money making that per year. This is before taxes. Look at this. The current law, you'll be paying $212. Under the House bill, which I don't think changed as far as healthcare goes, was $104 for a bronze plan. Still $7,000 deductible. Now for a silver plan, it went from $321 to $211. Still paying almost $5,000 in deductible, and for a gold plan, it's $349 to $240. Like, people cannot, and that's over, $3,000 a year if you get the gold plan. Over $3,000 a year you're spending on healthcare. Before deductibles, before copays, it doesn't even mention prescription drugs. All right, guys, these are small, tiny little fixes to a huge issue. Band-Aids on a bullet wound. And passing this and they're celebrating it, like, this doesn't make me feel like they're going to want to pass a public option. They're going to keep trying to subsidize this and say, oh, it's great. Everyone, who needs the help is going to get the help. Even though it doesn't, it falls short in so many ways. If you're making $40,000, $50,000, you're still getting screwed. Now let's look, $80,000. Like, Joe Biden was supposed to be middle-class Joe, right? $80,000. I mean, it really depends on where you live, but in some big cities, you are like lower middle class making $80,000. Look at these plans. The deductibles are still $7,000, $5,000, and $1,600 for the gold. And you're paying almost $400 a month, or over $400, almost $430 a month under this new bill. Like, you see that the changes are so slight. And so they're not actually helping middle class people. And when you spend $1.9 trillion and you're barely, the 8 people making $80,000 or more are not going to get any relief check, right? You could have been, struggling. You might have taken a pay cut, or been furloughed or any of these type of things, and you're not getting taken care of, even though you're a middle-class American. So they really targeted this relief bill to help the very poorest, which is great. But if you leave out people that are, $40,000, I don't even know if you can call that middle class. That's still very much a working class salary. $80,000 still, depending on where you live, still a very, lower middle class salary. And these people are not being helped. So, and this is just, and not even to say that if you have a family, if you're under a family plan, you can see here, your plan, deductible and out-of-pocket maximum for a family plan is usually double of an individual plan. Double. So, I just think all these numbers that they're throwing out, and they're saying, we cut child poverty in half. Well, the poverty line is $12,000. Even if it's a family of 4 making $27,000, technically by the U.S. standard, is not in poverty. Tell me how you can raise 2 kids, family of 4, 2 kids, or if you're single, 3 kids, with $27,000 a year. But they won't give you, that help because technically you're not in poverty, or technically your children aren't living in poverty. So I don't believe the reduce it in half. I don't believe that stat. And you shouldn't, because these are based on arbitrary guidelines, some of them from the 70s and 80s when this stuff was set. So, I mean, these are just neoliberal fixes, small fixes to huge problems. And that's the issue. The issue is we haven't, when that came out, when Biden was wanting to do the Cobra subsidies and Bernie wanted to do, expand the Medicare, where was the left pushing? Where was the, outcry? No, you have a choice. You need to tell the American people Biden has a choice. He can either expand Medicare, help a huge amount of people, save the government money, or he can give Cobra subsidies to these, insurance companies that are already stealing, cheating and stealing money from you, or he can do that. Here's the dichotomy of these two. There's a dichotomy here. There's two choices. We're going to pressure Biden to do the thing Bernie wants to do. There was no pressure. I didn't hear anyone pressuring. I didn't hear any House progressives. I didn't even hear Bernie really pressuring Biden on it, because they're completely kowtowed to him. They've accepted that it's Biden's party, that all the people that supported Bernie in the primary just don't matter. We know how the primary was completely controlled and, formulated for Biden to win. I mean, he was winning comfortably in states that he didn't even have campaign offices in. That's how much the mainstream media and their narratives helped him. So we need y'all to start fighting, because there's a lot of people that supported Bernie and support that style. It's almost half of the party, if not 40% of the party. So you have you represent a large amount of the party. So when are y'all going to start pushing him left, actually holding him to account, instead of just letting him ram through whatever he wants to ram through and then acting like it's some huge fix to the problems that we have in this country? It needs to start. It needs to start, because they're going to keep pitching these small fixes as some grandiose thing that's going to help a lot of people. And then in 2 years, when those people actually still are struggling that they claim to have helped, they're going to grossly overestimate how many people are going to come out and vote for them again. I mean, there you have it. Just throwing money at corporations, insurance companies once again.